He should be able to join us back in a little bit. Are you there? Yes. Okay, we're back in. All right, Dan, this one is for you. In 2024, you guys were listed as one of the fastest growing agencies in the country, which is, I'm sure, very welcome for you guys. I would like for you to tell us who you are and what you do at Fusion, and then I'll let Brandon also take the same question.
Okay. Yeah, we were really excited to be recognized as one of the fastest growing locums companies by SIA. Wasn't the first time.
Yeah.
A really good group of people here that just know what they're doing and know how to care about providers and healthcare systems. And so they execute and they're passionate about what they do. And from that, you get a fast growing organization. And yeah, I started Fusion along with Jaron and Rob about 11 years ago. We started it back in 2013. And the idea is we just felt like we could do it better. We've had, in our past experiences, we had physicians and providers tell us, like, I just feel like a number, right? And so they weren't really getting that personalized, specialized approach. And so we just felt like we could do it better, and we could support them better. One of the mantras that we have here that we regularly say, and it's a little bit ironic how often it comes up almost daily, is what's best for the healthcare system, what's best for the provider, and those are at the top. What's best for Fusion, what's best for the individual. And so every time we're at like a difficult decision that we need to make, we always just say, all right, what's best for the healthcare system? What's best for the provider? As long as we have that first and foremost in our decision-making process, then we feel like that guidance, right, that system is going to help us be okay in the long run.
Yeah.
Yeah, that's a little bit about Fusion and kind of, why we're one of the fastest growing locums companies.
Okay. What about you, Brandon? What do you do at Fusion?
So I joined Fusion in 2017. Came over here, and I am now sitting in a management role, division manager role, managing two different divisions. Both our anesthesia, which includes CRNA, and cardiology are all lumped into one division. And then we have urology and gastroenterology division together. So I manage both of those divisions.
And when you say that, what's the biggest part of what you do? Is it in managing the people? Is it in the recruitment process?
Yeah, so it's definitely managing the people, supporting all of our recruiters and business development folks, and assisting them where they need some help in a problematic situation where they might need some advice or need some guidance. And then also finding ways to help support them in their strengths and then overcoming their areas of weakness.
Okay. So if I'm a recruiter and I work at Fusion, you're my boss. Is that right, Brandon?
Yeah. Yeah, I'm one of them. If you're on one of our team, if you're on one of the teams I manage, then yes.
Okay. Very cool. All right. So let's start with the question that I've heard a lot and that I've had myself before getting on the business side of things. Why do staffing agencies exist in the first place? This one's for you, Dan.
Yeah, look, there's probably lots of different ways to answer this, right? And when you segment it down, particularly to the healthcare staffing segment, right, that we feel like we're experts in, what we see is a shortfall of maybe awareness to healthcare systems. Right? Maybe they're unaware of the difficulties that they have recruiting full-time permanent candidates, and that could be a variety of reasons, right? Location is a big one. compensation packages. They just may not understand that they're not that competitive in the market, right? Or they've got some kind of internal bureaucracy that just makes it challenging, system obstruction that makes it challenging to work there, right? There's a variety of reasons. So one of the things, or the solutions that we help solve, right, is identifying that for the healthcare system, right? And kind of giving them that transparent feedback that we're hearing from providers that maybe is a little uncomfortable for the providers to communicate. And that's more broad, right? The locums industry, we're dealing with people, and there have to be immediate need, responses for healthcare systems. And, locum kind of fits into that more urgent need, right? Rather than you're having contractual changes where you just need personnel, right, to help keep the patient flow through. And we provide a big support, especially in those realms where there's contract changes or just physician and provider shortages. There's not enough providers to cover the patient volume and the patient need at a healthcare system, right? And where you have a little recruiting department that is in a rural area, and they might not have the tools, the ability, right, to go out and find a passive candidate that may or may not be looking, right, to really kind of attract them and find out what it is that they're looking for and trying to accomplish professionally, and see how that could, fit into their solution. So I think that's probably the biggest reason why, is that outreach that's required very often at healthcare systems. It's an intentional outreach, right, to attract talent and bring them in, and that's just across the country. There's that demand.
Yeah. So I'm hearing you say that, one, hospitals may not be able to handle the sort of aggressive outreach that they need to have in order to fill their staffing gaps. One. Two, they might not understand their competitiveness in terms of location, pay, things like that. And you bring that information to them to help them understand. Okay, very cool. What about for the provider? What is the real value that you offer for, let's say, a CRNA?
Brandon, what do you think?
I would say that our biggest value is, well, when it comes to locums in general, the biggest value is providing sort of a work-life balance. And you can work as much or as little as you want when you're working as a locums. So it provides you flexibility and freedom. I've been working with a physician since 2012 in various companies that I've worked at. And her biggest reason for enjoying locums is that she can work as hard as she wants one month, and the next month she can work as little as she wants. And there's no set, hours that she has to get. It's all based on what she needs to do from a financial standpoint for her own support and things like that. So I think that's probably one of the biggest things. The support that you get from a locums agency is different than anything you're going to receive taking on a permanent job or taking on a job, trying to take on doing locums individually. We help with licensing, we help with credentialing, we help with your travel. We look for new opportunities for you if you're not happy in the ones that you are in. You have sort of a agent, if you will, that's looking for you and wanting to find opportunities that meet your needs. And so we're doing a lot of the legwork for you and allowing, CRNAs or physicians really the opportunity to just focus on doing what they've gone to school for and, allowing them to just practice medicine.
Yeah. As someone who's done locums for more of my career than I have not, I'm super grateful to be a CRNA in the first place. It's the best job in the world. But also, other than, being a locums founder, but it's also like really, really allowed me to create and craft the life that I want. And I think that's why a lot of people are interested in this way of work. And I know you know this, Dan, because you're nodding. After COVID, the demand for this type of work just really exploded because it was the first time that people saw that balance that they could really have. And it's like Brandon said, I can work super, super hard for 3 months and then take it easy for another couple of months or whatever. So a lot of people are curious about this. What tends to kind of become a little bit of a friction point that we see is what I'm going to get into next, which is really the money, right? A lot of people are attracted to this because they want to make a lot more money than they're making in their W-2. It tends to be more lucrative in general for people to do 1099 and to travel and get stipends and all these other things. So how does Fusion get paid? You're delivering all this value to your clients, to the providers. You're taking care of all this work, booking travel, doing the malpractice, getting the credentialing done. So how do you make money?
Yeah, it's a great question. When you go to a healthcare facility, they have a need for a CRNA, right? The items that we cover that malpractice, we help with the credentialing process, right? All the things that Brandon listed.
Mm-hmm.
Right? And then all of the cost of, compensating an individual to do the outreach, to find the provider and to, help them understand what they're looking for to see if this opportunity matches, kind of the criteria. If it's money, if it's location, if it's balance, right? Whatever it is for that provider. So that service that we provide, right? We bill the facility a set dollar amount, and then we pay the provider a set dollar amount.
Mm-hmm.
Right. So that's spread between that bill to the facility and the pay to the provider, taking out malpractice costs, commissions, to the individual recruiter, and then all of the other costs associated with running a business. Right. That's where we make our money.
Yeah. So what people want to know is how much of what the hospital pays does the CRNA actually see on average? What would be your answer to that?
The vast majority of it.
Mm.
And in really just transparency, right? In any staffing segment, whether it's primary, we primarily focus on physicians, CRNAs, one of our biggest segments, NPs and PAs. Mm-hmm. You're going to have some portion of margin that is allocated to the staffing agency. And that's going to vary anywhere between 15 to 35% of that bill rate gets allocated. Mm-hmm. The higher the percentage, the higher the risk, and the greater the cost, right, associated with it. The malpractice expense for a neurosurgeon is different than a family medicine provider, right? And so you see that fluctuation in margins.
Yeah. Okay. Are you ever able to kind of negotiate on that margin depending on whatever the pressure is? Maybe it's filling the role or making the provider happy or anything like that. How is that sort of discussed with your recruiting team as to how do you incentivize people to negotiate and prioritize that margin preservation versus, what other else might be on the table?
Absolutely. Look, there's probably endless work that we could do out there with zero margin. But if we do work without margin, then you're not going to get engaged recruiters that care about you, right? Just the same way that a CRNA wants to be compensated because they are competent, they're quality, they're going to see a lot of patients, they're going to drive volume, they're going to be dedicated, they're going to be committed, they're going to be focused, right? They're going to be energized. You want that in a recruiter. Right? Everybody wants that type of individual. They want to collaborate with them and associate with them and work with them. And so we are very driven, in the same way, right? We all are. Mm-hmm. So to your point, how do you balance, right, the piece of the pie that everyone gets? And you've seen it, you've lived it over the last few years. The rates in the market are driven by CRNAs. Mm-hmm. Right. And when a client comes to us, they're like, we need CRNAs, and we tell a CRNA, hey, this is the rate that the client wants to pay. And they're like, nice try. I'm getting this rate over here. And we just say, hey, look, let's try it. The worst case we can do, the client can say no, and we'll let the client make the decision because they may be in a situation that they need that provider And there's some revenue that's generated, right, from a CRNA.
Mm-hmm.
And there may be thresholds where the healthcare system is willing to go up to or beyond that, depending on the situation.
Mm-hmm.
So CRNAs are out there looking, I just want top dollar amount. That's all I'm looking for. We're fine with that approach, right? Most likely in the circumstances that we've had, depending on how dire of a need and how long it takes to find a replacement, that top dollar CRNA, even if they're the best, we've worked with some incredible CRNAs that the facility loves. And it was painful to say, like, look, you're the most expensive. We have to let you go, right? Unless you want to bring your rate down. And so we are always trying to find that balance. And if you look at our margins from a CRNA perspective over the last few years, they have shrunk. Because we are trying to say, look, yes to the provider and yes to the client. And we want to do what's best for the provider and what's best for the client. And that's demonstrated in our margins. Our margins haven't increased with the demand. They've decreased, right? And so that's a constant battle too. We're like, hey, look, we've got to figure out how we continue to thrive and grow and provide recruiters, so that we can continue to serve. So I don't know if that answers your question a little bit.
Yeah, it definitely answers my question. I think that was good context, good texture in the context as well, for people to understand what's going on the back end. But we'll get into negotiation and rates a little bit more later. I have a specific example actually from some of y'all's chat logs. You guys have been connecting with CRNAs on Locum app, so it's been very interesting to see that exchange between the business side, the agency, and the providers, and they give us feedback constantly also. So I'm going to kind of dive back into that a little bit, but I want to pivot for a second and talk about trends in the market, right? Like, you guys have been doing this for a while and you do it across different specialties. So what is the biggest shift that you would say you're seeing right now in CRNA staffing?
Brandon, I'll let you kind of speak to that first.
Yeah, well, I would say that the biggest shift is, I think there's two things that I think are coming into play. Number one, I think that pay rates are playing a big role in the clients or the facilities willing and wanting to utilize CRNAs. And as a result, there are anesthesia groups and hospitals that are trying to go a less expensive route, which you and I have spent some time talking about, and that's utilizing the certified anesthesia assistants. And so while that's not affecting everybody, because not all states can utilize them, I think that's one of the things that we're starting to see with some of the larger anesthesia groups and some of these hospitals is they're trying to find a workaround for reducing their costs and getting somebody in to do the work. Now, can a CAA do the same quality of work that a CRNA is doing? No. And they can't do what the CRNA is doing, but that's one of the things that we're starting to see a little bit more of. And, but right now it's almost, I remember about, I've been doing this 16 years. I remember when the hospitalists first started, hospitalists were relatively inexpensive. They were getting paid $10 or $15 more an hour than a family practice primary care physician to do hospitalists. And all of a sudden their pay rates, they asked for, their pay rates were going up, and hospitals were being apprehensive to paying the higher bill rates. Eventually it sort of evened out where the demand for pay came down a little bit and the willingness to go up in pay went up. So I think that we're probably going to see something along those lines with CRNA coverage as well, where the CRNAs that are demanding $250 and up are going to have to come down to $215, $220, $225, and facilities are going to have to go up a little bit in order to pay those rates. And I think we're going to see that over this course of this year, where we start to see more of a kind of an alignment in what CRNAs are wanting pay wise and what facilities are wanting bill wise.
Yeah. I have so many follow-up questions to that, but I'm going to try to keep it as short as possible.
Okay.
So is the trend that you're seeing in sort of seeking out more alternative, lower cost options, namely CAAs, that's mainly driven by just the cost of CRNAs right now. Is that correct? Or would you say
Oh,
that?
absolutely. Absolutely. I would say that that's 100% the driving reason behind it. And truth be told, it's also the folks that I guess maybe created the CAA, I guess, business line, if you will, or the education. You're
Mhm.
starting to see some of those folks, kind of push their way into systems. And so I think that's playing a role in it too. But I think the willingness to even consider it is based on the fact that they, can pay significantly less for somebody like that. I mean, it's, you're bringing in an advanced practice provider comparative to a trained professional, if you will.
What would you say to, oh, go ahead, Dan.
Well, I was just going to add, look, as an agency, right, you're in this unique dynamic, and there's different types of models when you have a locums agency. There's the most common are like a 3-desk, 2-desk, or a single desk model, right? And the idea is that we do a 2-desk, right? So which means you have a client representative, someone that works directly with the healthcare system, and then you have a provider recruiter that works directly with the provider.
Mhm.
Internally, we have these debates.
Mhm.
This person in the client side wants to represent the client and say, look, we're not willing to pay these rates. You can't, right? These are the rates they have. They have a budget. We need to stick to it. This person is telling them, we need to pay this provider more. They're worth it. Look at all of this reasons. You have this ongoing battle.
Mhm.
And we can often get blamed as an agencies in the staffing industry for the reason of driving these rates up. And that I would say that's not true. In fact, we probably help facilitate, right, that education on both sides so
Mhm.
that they can make better, more informed decisions of like, hey, what's happening is for CRNA, if you ask for this rate, you may get it temporarily. And if that's what you want, that's fine. The healthcare systems are moving in a different direction, trying to bring costs down, right? So internally, we serve both masters, and we really want to, be an advocate for both
Yeah.
people. And we feel like that's the best approach, right? To not be one-sided.
Well, I have two questions that two points that might come from CRNAs in response to that. It's what I see often, and I want to get your response to the two most common sort of counter arguments that you'll hear from CRNAs in the market about that. Number one is going to be, well, no one's trying to say that anesthesiologists are too expensive. So what's your answer to that, right? They'll say, as a CRNA, why don't you get the hospital to use more CRNAs or pay their anesthesiologist less because of, one reason or another that a CRNA might bring up. Why aren't they trying to reduce costs by using less anesthesiologists and more CRNAs? You'll get that response. And then the second response you'll get is, the agency is making so much. Why don't the hospital just contract directly with me and give me that money? So what's your response to both of those?
I would say the healthcare systems are saying that anesthesiologists cost too much, right? I think labor costs is something that a healthcare system, it's on one of the top line items, right, of running their business that they want to continually try and manage. So I would say that that's not necessarily true there's very rare that that they don't cost too much. And number two, look, that's a reality of, kind of removing the agency out of it. And there's healthcare systems that are trying to do it. And there's, technologies that are trying to do it. And are we going to move in that direction? Hopefully, right? Because that'll bring costs down. We feel like we can still add value, right, where those systems aren't applicable or it's not possible. The demand that we need to service across the entire country is never going to be filled by, I mean, look at Uber. Is Uber taking over the taxi market? There are still yellow cab taxis out there, right?
Mm.
Will self-driving take over the market? There will still be scenarios where a human has to drive, right? And I think until we can get way far down the line into the future and overcome some significant obstacles, we still need people that are passionate about bringing these two parties together in order to accomplish that. Not from a let me get mine mentality, but from a solution oriented mentality. There's rural facilities. So just to give you a quick story, my wife delivered 3 of her 4 babies with Dr. Tanner, an awesome physician. He delivered both my partners. So this is a close friend of ours. So he actually delivered Jaron and Rob, and then he delivered 3 of my kids. And in the tail end of his career, he became a locums provider with us.
Wow.
And now he started serving these rural facilities in Maine. And how cool is that? That at some of probably the best years of his career, he gets to serve the rural facilities that otherwise wouldn't have an OBGYN right in their facility. Fusion started by Dr. Goddick he worked 2 days a month in Rawlings, Wyoming, and he was the only psychiatrist to serve the whole city. And he was there 2 days a month. You know, when people think like, oh, they got to get theirs and they're all just driven about money, those are like the cool things that we relish in that really make it meaningful for us. Like we're providing a valuable solution and care of treatment for the entire country, right? So there's a balance there, and we as technology evolves, right, we're not afraid of it. We're going to embrace it, and we're excited about it because we feel like it can make us better.
That's a great segue to my next question, which is how technology has changed your approach. Obviously, you're a tech enthusiast, Stan. I love that about you. So yeah, I know you guys have gone through a big technology change here recently. You're adopting, new ways to do what you're doing better, more efficiently, which will for sure speak to kind of preserving those margins so that your overhead costs are just a little bit less and you can do what you do, better. So in terms of how technology has changed your business, I'd love to hear a little bit about that. And then, are providers still picking up the phone? Is it more apps, more platforms? What are you guys seeing in terms of, trends there?
Brandon would be interesting to share this one because when he started, you calling out of the yellow pages, weren't you, Brandon?
Yeah, when I started in 2009, we had blue books, which were hospital listing books that we called out of. We didn't have like mass communication capabilities. And in fact, our contracts were always sent via fax. They weren't sent even via email in our contracts. So it was a much different process, back in 2009 than it is today. That's for sure. From a technology standpoint, I still am a firm believer, and, we can talk to recruiters within our company that they have just as good a success getting folks on the phone as they do text and email. Now, are the numbers going to be the same? No, because it's easier to send out 1,000 text messages in, the span of a few minutes versus making, 100 phone calls. So the ratio may seem like it's significantly higher to text or email responses because you're sending out you're casting a wider net, right? But getting people on the phone, people still want to talk to you. They still want to have that personal relationship with somebody. And so I feel like at some point, there still is that need for phone calls because you want to have trust. The providers want to have trust with the recruiter that they're working with. And the recruiter wants to be able to trust the provider, right? There needs to be trust going on both ways. And you can't accomplish that having a communication solely via text or solely via email. It really truthfully has to be done over the phone. And so I think that's a big one. Some of the apps and some of the web pages allow for communication between providers. But there's so many out there that are offered that I think there are certain providers that are becoming sort of, I guess, turned off on utilizing the technology, because the more you put your name out there, the more you're just getting hit by, recruiters or some sort of salesperson that buys that information or whatever it may be.
Yeah.
And so I think as we go on, I think of a platform like Doximity, where they've tried to create a platform for all doctors to go in and utilize it like a LinkedIn type of environment for physicians, right? Where they can share information and there's HIPAA compliance within their software. However, doctors are still getting hit up by agencies because Doximity allows for you to buy into there. And so doctors are turned off a little bit by, hey, I thought I was joining this sort of medical community, and now I'm getting hit up by pharmaceutical companies. I'm getting hit up by recruiting companies. Like, this isn't what I signed up for. And so I think there is a little bit of trepidation when it comes to joining into all these apps and platforms, because they know it's just putting their information out even more.
100%. And that was one of our kind of issues when we first started and launched Locum app was, recruiting agencies or just even individual recruiters would say, well, I want to be able to go into a database and just like message people. And I think one of the reasons that we've been able to get as far as we have is that we said no to that. CRNAs, especially bombarded, whether it's LinkedIn, WhatsApp, text messages. Myself, I could sit here for a few hours and I'll get a couple of text messages because people are just mass messaging. And so to be able to create that kind of environment where, yes, you can still have phone conversations once an initial, match is made, but that we're not essentially like opening up a database for people to come and like mine for CRNA information is like super important. And I, as a clinician myself, that was the impetus behind that. I just thought that you felt like a little bit hunted in the market. So not ideal for people. So switching topics for a little bit, let's go back to negotiation. I want to talk about rate negotiations because so many CRNAs feel shut down when they ask for more money. Like, they know that they're a valuable piece of this sort of like surgical engine, and they're keeping these hospitals open in a lot of cases, right? That you can't do surgery without anesthesia, and without a surgery business, you really don't have a lot of revenue coming into your facility. And so there's this sort of like struggle that I see play out all the time, that like, I'm such a valuable service, and yet and still you're trying to pay me what feels like not my worth. We hear that a lot, like, this is not my worth. And so there was a CRNA that was negotiating recently on Locum app, and one of his pieces of feedback was, I haven't even like, he kind of has a set rate basically that he wants. And he feels like there's different things to sort of like negotiate back and forth in order to get him to that rate. What's really interesting about this provider segment, I think, is that they're very knowledgeable about the business of staffing in a lot of cases, not everyone, right? But they understand margins. They understand, you're covering malpractice, and they'll say, I have my own malpractice, don't worry about it. But I know that there's a lot of constraints that also go into that on the back end. Maybe the client says, no, absolutely not. I want the agency to have the liability when it comes to this provider's malpractice or things like that. So the question that I have is, beyond pay, what else can CRNAs realistically negotiate through an agency like yours? But before you answer the question, I want you to actually listen to what he said, which was, he said, I could probably save them 10 to 12% just by changing my account receivable to 30 days so that they pay me once a month rather than twice a month. And that would mean that, the idea behind that is that the agency wouldn't be paying interest on the money that is floated, to them by the bank in order to pay the CRNA while they're waiting for the hospital to reimburse them. And I think it's great that the CRNA even has insight into the business operation, like that. But is that really a negotiation that you can have with a CRNA on an individual level, that's what I want you to speak to, because I explained this to the CRNA at the time. And I'm like, it may just not be a match. It's unfortunate that they aren't able to kind of like negotiate with you on that. But I bet you there's an answer to this question. And I kind of penciled it down for us to talk about. So yeah, go ahead, Dan.
Okay. Yeah, there's quite a bit to unpack. So I'll try and be concise. Number one, if a CRNA gets to the point where they can have an awareness of who they're dealing with. CRNA is interesting because it's right in the middle of kind of nursing and physician, right? And so you've got this mix where you have a lot of nursing influence, but then you have a lot of kind of independent practice influence, right? And in the nursing space, there's a tremendous amount of MSP VMS. You're familiar with that?
Yep.
So you have these huge either staffing firms or
that a little bit for people who don't know. Yeah.
And an MSP is a managed service provider. So it's a large, generally a healthcare staffing organization or some other, independent organization that goes to a healthcare system and says, we will manage all of the various staffing agencies that you have. And then you will use our VMS, our vendor management system, which is like the technology. Once you start introducing a VMS and an MSP type structure, you narrow your flexibility because they're trying to systematize everything, right? So if you understand who the agency is recruiting for, and if it's through an MSP or VMS, you'll know that a couple of things. Number one, the process is going to be a little bit more rigid, right? Because the client wants a standard process that they can have visual into expenses. Number two, you're going to know that your rate negotiation can decrease. One of the big selling points is an MSP VMS is, hey, we will also standardize your rates. We have access to so much volume that we know that we can drive rates down, right? So they'll need to understand they may have to sacrifice rates if they're going to work through an MSP or a VMS. Those rates will get slightly standardized. They won't have as much negotiation power in their rates. If it's a direct relationship, is what we call it. We have an independent contract with the healthcare system that broadens the flexibility dramatically. It's an agreement. We can adjust, details through a confirmation letter, and everybody can agree on it. So, my thought with this is the long part then of the answer a little bit. When a CRNA is negotiating rates, it may be annoying the way we handle this, but it's not the intent. We really want to understand why, right? Because if we understand why you want a high rate, or if that's truly your most important objective, then we will only pitch you jobs where you're going to have a high rate, but you are going to have to sacrifice something. If the only thing that you want is a high rate, then you got to work your guts out in a crazy location that can't find anybody, right? That's the sacrifice. If you're like, no, actually, I really want balance and I want flexibility. Clients in these situations, they're looking for someone to come in and work as much as they can for as little as they can, right? But the way that clients look at providers, if they've got a list of 10 CRNAs, they're wanting to know, can this CRNA cover our schedule in the locums world? Number one, can the CRNA cover our schedule? So if you're like, yeah, I want a high rate and I only want to do weekends, it's like, this isn't the right, this is not the right rate. Can they cover our schedule? Can they do the procedures? And then they look at rates. So in our experience, clients don't even necessarily care the most about rates. They care about coverage, quality, and then rate, right? So if as a CRNA, right, you've got to understand really what you want, because, and it's important to be, you have to trust your recruiter, and you also have to be firm, right? If you have a specific rate, then we will do our best to get you that rate. Our skin in the game is to make a match, not to talk you down to the lowest rate that we possibly can. We care far more. What's best for the client and the provider is putting them together than it is maximizing our revenue, right? So and look, every agency may be a little bit different, but that's our mantra, right? Kind of our internal culture, is to make those connections. So
yeah. So I'm hearing you say that depending on the client, there are some things you can negotiate. There are some things that you cannot. There's some flexibility with certain types of models. and not a lot of flexibility with others. And then you're also saying that the CRNA, depending on what their objective is going to have to kind of take a look at what other things they're willing to sort of accommodate in order to accomplish whatever that primary goal is. Heard.
Yeah.
Now, for a CRNA who knows enough about the business to be able to say, hey, you know, on this job, you know, I'm getting this rate in the area. I'm kind of giving you a discount actually, because I can save you an extra however much percent. What I did with that CRNA was I actually made a spreadsheet and showed them, you know, and showed them what the actual margin on that was going to be. And it was like -2% or something like that. And I was like, any recruiter that made this deal with you would get fired, right? So that might help you understand. But in that situation, you know, their frustration is the agency is trying to, you know, get over on me. And I want to talk about that. I've felt that a lot. I've actually been taken advantage of before. It literally is what led me into this path of, you know, starting a business and creating Locum app for CRNAs. Now, what do you say about that mistrust that exists in the industry? Obviously, we can't all like get in there and fix that today, but what are y'all doing, you know, to bridge that trust? What do you say, you know, to CRNAs who will say, well, I don't want to even let you present me because then I may be locked out of a job, or, you know, you might present me without my permission or whatever. Yeah. What do you say about that lack of trust that exists and that feeling that, you know, the agency's in it for the money, and so they're not going to have my best interest at heart, and I kind of need to fight that.
Yeah, I've got some thoughts, but I'll bring.
Yeah. Brandon, you want to take the first stab at this?
Yeah, absolutely. Yeah, look, I mean, this is what I kind of talked about earlier and alluded to earlier is you have to have trust, right? And you have to build that trust. Part of that is being able to have those conversations with providers and speaking openly and honestly about situations. As you mentioned, there are certain you know, anesthesia groups that allow for some negotiation with regard to rates, and there are others that give us a set bill rate and say we won't go above this rate. And I think being able to speak honestly with our providers and share that information goes a long way to building that rapport, because if we're afraid to share financial information with a CRNA that we're working with, we're probably doing something wrong, right? And if I'm not afraid to share with them exactly what I'm billing or what I'm, you know, and what we're paying them and all those things, you know, I think that goes a long ways to build that trust and rapport. I do, you know, I have had conversations over the years with people that are like, oh, you're just trying to make a buck on me, or just, you know, going to work me till, you know, I can't work anymore. And you don't care because you're still making your money, but I need to get paid. You know, we've had those conversations, and truthfully, it goes along with how can I get that person to feel like I have their best interests in mind, right? And to Dan's point earlier, where we talked about we want to do what's best for the client and provider, number one, what's best for Fusion, number two, and then what's best for our individuals within our company is the last. We have to be able to demonstrate that to these folks so that they know when we're speaking about this, that they can trust that we truthfully have their best interests in mind, because otherwise you're going to have a hard time as a recruiter if you can't get providers to trust you. And if you can't get providers to feel like you have their best interests in mind. And that goes, you know, to things like, if a CRNA says they don't do regional blocks, you know, this is as simple as this, right? They don't do regional blocks. I can't send them jobs that do regional blocks, because it's basically that I'm ignoring what they say they won't do or don't feel comfortable doing. Right. And so that's part of building that trust and rapport and getting them to understand that, hey, look, I am looking out for what's best for you. I'm putting you to jobs that, you know, are giving you information on jobs that match what you've told me you want to go do. And so again, that's just, you got to have phone calls with people so that you can get them to believe that you are actually working in their benefit
Mhm.
or for their benefit.
Yeah. Anything to add to that, Dan?
Yeah, I mean, look, um, I've tried to adopt this mantra that it maybe kind of coincides with this. I like making money off people, and I like people making money off me.
Mm.
Right. And if we as a recruiter are providing a high value where you do feel like this person truly gets what I'm trying to accomplish professionally and financially, and they are seeking out the greatest opportunities for me, not only in the states I'm licensed, but maybe there's other states, right? Because they understand that I've got a dog and I love to travel with this dog. They really get me. To me, I would pay more money for that, right? If
Mm.
someone who's just coming in and just trying to make a quick dollar off me, then I would feel that way, right? And so, but we have continuing education and just ongoing personal development is a critical part of our business. We're
Mm.
learners, right? And we love to create a greater awareness around what we're communicating and how we're interacting with people and the value that we're creating and we're bringing. And so when you bring on someone brand new in the company, they might not have that quality yet, but over time, right, they will. And so
Mhm.
it's just, look, I get how challenging this is for a CRNA, especially because you get bombarded and you kind of get exhausted, you
Mhm.
date everybody and really trying to establish that.
Mhm.
And so, I mean, Joy, that would be a response that I would love to hear you. How can we demonstrate that so that, how can we do that better so that the people don't feel like we're used car salesmen? I heard us compared to that and I was like, do not ever
Mhm.
want to be compared to that again, right? That's not, unless it's a car salesman that you never want to leave because he knows he's treating you right and he gets what you're trying to accomplish, right? Then it's like, okay, yeah, but that's a value add, right? Like we would love to know how to do that better because we will change, right? We will be better, right?
Yeah. Yeah, I think, I mean, you have to remember that the barrier to entry into, creating a staffing company it can be pretty low. And so there are a lot of different players out there that operate, in various ways. So a lot of people have those questions because of experiences that they've had in the past. And that especially for someone who it's their first encounter, with a staffing company or a recruitment agency, and they get the short end of the stick and they think, oh no, like, I'm in a pool of sharks. Yes, I'm going to be very defensive. I mean, people who won't even give out their NPI, which is public information, because they're just so guarded. So it's not a problem that we're going to solve in a 1 hour Zoom call, but I'm happy to hear your response to that. And then to kind of wrap us up, this has been great, but I want to hear a little bit more about what you're experiencing, what you're seeing, what you're hearing in the industry about CRNAs and just our uniqueness in terms of, staffing. What are like the top 3 things that you would say set CRNAs apart in the industry compared to other providers? I know, Brandon, you said that you're supervising teams that also are working across like GI and other specialties. Yeah. So what do you think is sort of different about the way CRNAs really engage in business and in recruiting with you?
Yeah. Well, first of all, I would say that CRNAs are much more polite than a lot of the physicians that we deal with. There is, and I think that stems from CRNAs get started as nurses, right? And there is just a unique sort of, I don't know, maybe a compassion when it comes to what you're doing, right? There's obviously that need for a CRNA, and that you understand that there are a lot of needs out there for CRNAs, and that you're providing a service, but it's just a different conversation when you talk to a CRNA than when you talk to physicians. And I don't know if it's necessarily, I mean, there are going to be CRNAs that have egos and, think they're the best CRNA in the country. And we're going to run across those folks, but it's fewer and further between those folks than it is on the provider side. And I think that goes a long ways to the service that gets provided by CRNAs, right? There's not an ego when they walk into a building as a locums provider. There's not I'm in charge when I come into a unique situation or a new situation that I'm working in. And so I think that people enjoy working with CRNAs on a locums basis. Not that they don't on a physician side, but there's definitely the amount of CRNAs that we get relieved of their duties because of their attitude or treatment of others is minimal compared to how often that will happen with physicians. And not that it happens a lot with physicians, but it's just not something you hear of with CRNAs. And I think that just comes from sort of the compassion that they work with or that they got their career started in as nurses. And so I think for me, that's one of the biggest things. And look, I will say this, that CRNAs too, I mean, they know exactly what they want to do when they are looking for an assignment. They know how much they want to be paid. They know exactly what type of situation they're looking to work in. And they do their homework about market rates and about what other facilities are paying for those services. And so that's pretty impressive to me, is the amount of homework that CRNAs do. It's not just like, hey, I heard the CRNAs are making this much. It's like I've contacted places that are offering this much, right? I've looked into this. There's multiple places in Illinois that are offering, $250 an hour, and I can go find a job in Illinois for $250. So I'm not going to look at jobs that are at $210. They do a lot more homework into, where they're coming from. And then they understand too, like, in order to get top dollar, they have to be able to offer, the full scope of services and availability, right? They have to be able to offer availability if they're going to demand top dollar.
Awesome. Anything from you, Dan, that just sticks out to you about CRNAs?
Echo the sentiment of the team that works with CRNAs. They really enjoy just the personalities that they get to work with. I think it's just first name basis, right? And you feel like you can establish good relationships with them. It's interesting to recruit the different specialties and see just the different dynamic of people. But then the other thing I would add is we are feeling the normalization of rates, right? And we're feeling that tug and pull. It seems like we are on the tail end of that, where rates are starting to stabilize. Rarely will they go back down, right? We saw this in Brandon hospitalists. We saw it in emergency medicine. We've seen it in radiology, right? They just go through these spurts, but they do level out, right? As healthcare systems and providers kind of work through those details. And I think we're seeing that
start to happen.
Yeah, and that's what's best, really, right? I mean, we'd love to see CRNAs making $500 an hour, but if that's the reason, then there's something else going on, right? We need that stabilization in the marketplace, so that the healthcare systems and everybody can kind of operate. And then the last thing that I would just mention is, as CRNAs, the demand is, it's still strong. It's job heavy, so it's a great place for you to be in. And if you can really define what you want, right, it's available. And just hopefully you can get a good recruiter that you can feel connected enough that you can communicate that and find kind of that solution for you.
Yeah. And that was going to be my last question was, what you saw in terms of, is it going to is the locums explosion sort of here to stay, or is it fading? Is it just a blip? Is it stabilizing? Are CRNAs going to be more in demand moving forward in the next couple of years? I feel like you really spoke to that well just now when you said, where it's I guess a buyer's market for the CRNAs. They really get to define what they want, and that's great to see. I'm biased, so yeah. Well, thank you guys so much for spending this time with me today and answering these questions. I think it's so important for us to kind of do our part in bridging that gap between, talent and opportunity and shedding some light into what actually is going on behind the scenes for people. So really appreciate your time. Yeah, and I hope we get to do it again at some other point.
Yeah, thank you, Joy. Hey, and
Absolutely, thank you.
congratulations on what you're building. I think it's so cool.
Thank you.
And just to see kind of your intention with this and your professionalism and your approach, I would imagine CRNAs really get value just following your content and just kind of being a part of this exciting opportunity. So congratulations, it's super cool.
Thank you so much. Thank you. Yeah, I think that there's a huge gap for just information and us being educated. So it's an honor to be able to stand in that gap. Yeah. I'll talk to y'all later.
All right. See ya.
Bye.
All right. Hey, thank you.
Thank you.